Faces as well. My name is Lindsay Trouchet. I'm the Vice President of Community Engagement here at the Community Foundation. We're so pleased to have all of you here sharing your Friday morning with us. Thanks for making time to learn about this really important topic. We have a really great panel of speakers with us here this morning, and I'm just going to take care of a few housekeeping items. It looks like most of us are on mute. But as you join us, or if you join us late, if you could just go ahead and tap that stop mic or mute button in the bottom left of your screen, and that will just help us to not have any feedback throughout the event this morning. We do want this to be interactive. We know a lot of you might have questions for the speakers or have a thought that comes up as they are sharing their slides as well. Feel free to chat your questions or comments into the chat button, or using rather the chat button. And we will have a time for question and answers at the end. Again, an interactive conversation. So we may even ask for you to unmute yourself and ask your question there. So if you're not comfortable chatting into the chat feature, that's fine. Save your question and we will get to it. I think we're going to leave about 10 to 15 minutes at the end for questions. So with that, I want to again welcome you all to the first in our Community Needs Education series. This morning, like I said, we're going to be sharing some information regarding mental health and substance abuse. And I know this is an incredibly timely and vital discussion in our community, but that discussion is being magnified to an even greater level, I think, in the light of this pandemic and COVID that's been going on. We will welcome our speakers in just 1 minute, but I wanted to kind of take a minute to set the stage for our conversation today and just share how we sort of got to this topic as a community foundation. And I'm hoping my slides advance here. Okay, so I see familiar faces. So I know that many of you know who we are as a foundation, and you know that our mission is to inspire ideas, ignite action, and mobilize resources to address the needs in our community. And we do that by connecting people like yourselves who are here to learn more about mental health and substance abuse, connecting those people to causes that matter, working with individuals to grow their legacies, think about how their charitable actions might affect our community for the good moving forward and hopefully forever. And funding our nonprofit organizations just to continue to improve the quality of life here in Collier County, in this place that we all call home, or second home for some of us. And as a community foundation, we have a great record of success in doing just that. We've served our community now for 35 years. Believe it or not, we celebrated our anniversary last year, socially distanced and via Zoom. Unfortunately, we weren't able to do some of the great things that we had planned, but I will say that we have a lot of stuff that we can celebrate, including a history of granting out nearly 200 million in grants to our community historically. And last year, 35 million alone out into the community, which is phenomenal. Now we manage more than 750 unique funds and more than 250 million in assets. And we could not do that alone. And we thank each and every one of you for being a part of that wonderful success and the important work that's being done here in Collier County. Pardon me. So in those 35 years, we've really grown to become a convener in this community for difficult and important conversations. We've taken a role as being a philanthropic first responder in times of need, whether it's a hurricane or red tide, or even now with COVID, and a trusted partner delivering on our promises. And because of that role in 2017, we set out in partnership with the Schultz Foundation on an important endeavor that I know many of you are familiar with, called the Community Needs and Assets Assessment. And we wanted to talk to our entire community and understand where and how we could continue making a difference. From that assessment, many results were brought to light in several areas that, coupled with conversations of 106 nonprofits, we started to identify different projects and identify 6 community-wide collaborative projects where we as a community foundation could partner with others in the community to invest and to create a lasting and positive impact here. And so those 6 areas are and were identified as environment and accessibility, education and employment, crisis and disaster relief, senior and veterans, hunger and housing, and the reason for today's conversation, mental health and substance abuse. And so I encourage each and every one of you to continue this endeavor. This is just the first step in learning more about this important conversation related to mental health and substance abuse. And if you received our email this morning, or perhaps you picked up the Naples Daily News, I encourage you, if you didn't, to go grab a copy and look for our special issue paper today titled A Sobering Reality, and you'll be able to dive deeper into this conversation and learn more about some of what we've discovered along our path with the community assessment and our conversations with the nonprofits, but even more so what we're looking forward to doing with our partners moving forward in these important areas. So in just a moment, we will hear from 2 wonderful community leaders that we are so grateful and lucky to have with us this morning. Scott Burgess from the David Lawrence Centers for Behavioral Health, and our own sheriff, Kevin Rambos from the Collier County Sheriff's Office. And I think before Scott takes the reins and shares his screen, we are going to share an important video with you all.
Had one evening, about 11 o'clock at night, I got a call from Chloe's best friend, and she said that Chloe had cut and she was unable to stop the bleeding. She had cut 30-something times on her leg and had gashing wounds.
I didn't start cutting right away. It helped more of as like a release, like an immediate release, not like something that would take over time to heal. It was that exact moment, that exact relief, that exact release. I discovered on social media that every time I went on there's a lot of pressure to be this perfect filtered image, and that's not life, and that's not what I want my expectations to be.
1 in 5 children are going to struggle with a serious mental health challenge in our country. That means with an average classroom size of 30, there are 6 children in every American classroom that are struggling with a serious social emotional issue, and yet close to 80% of them are not receiving any care. We've seen that growth continue to happen year over year, and that's why we have to add 3 more beds onto our children's inpatient unit. Children are struggling more and more, and they're struggling with thoughts of harming themselves and sometimes harming others. And we've seen with the Parkland situation how important it is to make sure that we identify these issues and get children into treatment as quickly as possible.
The hardest part about, in hindsight, dealing with my daughter's depression, suicidal thoughts, self-harm, was not having the answers and not being able to help her. I took her to the David Lawrence Center at that point. I didn't know what to expect. I just knew that we were getting so dangerously close to losing her. After a couple days in the crisis unit, they had put her with the CAT team, the community action team at David Lawrence Center. And it was the best thing that ever could have happened to us.
I started using when I was 12. I first used alcohol and marijuana, and it gave me an escape, and I felt happy and joy for the first time in a long time. I realize now that I was masking the symptoms of my bipolar disorder with using drugs and alcohol.
Last year, David Lawrence Center provided over 277,000 services to almost 10,000 unique individuals. That's the highest that we've ever had in our entire 50-year history. There are 2 suicides in America for every homicide, and we know that suicide is the 2nd leading cause of death for children and young adults in our country. These are preventable but life-threatening conditions.
I was attempting suicide on a daily basis, by trying to overdose myself, and it wasn't working. And while I was in jail, I learned about detox, and that's where my recovery journey began. While I was in drug court, I had to have a safe place to live, and I did not want to go back to the scene of the crime, which was my home. So I opted to go into sober living. I am so excited that David Lawrence is opening a sober living home because we are lacking in that area in Collier County. After Crossroads, I relapsed 3 times. The first relapse lasted 2 months. The second relapse lasted 2 weeks. My last relapse occurred while I was in drug court, and they gave me a chance. I love David Lawrence Center. I love the staff there, and they've seen me grow. Today I've been sober for 3 years. I have my family back in my life. They trust me. They know that I'm doing well for myself, and I'm going to school to counsel addicts. Helping other addicts is an important part of my daily life, and I always let them know that they're loved and that they're worth it and that they can do it.
I will celebrate 35 years in recovery this summer, and recovery has been my passion since it changed my life. Recovering people have the unique ability to help those that are coming in, and we may not have an education, but we can save lives. People that live in transitional housing, their statistics at staying sober rise exponentially because of the support that they find in that safe environment. The new Hope Home at David Lawrence is the crowning jewel that will complete the continuum of care, because a Hope Home will provide long-term support, which people new to recovery need, which allows them to make it to a long-term recovery and a fabulous rest of their life.
Florida's 50th out of 50 in funding. That means we're the worst funder in the entire country related to resourcing services related to mental health and substance abuse. So what does that mean? Every year it costs us more money to provide the service. And in a growing community with growing needs, that gap from what we're paid by the state to what the needs are continues to grow. The gap is $2 million. We've been able to raise $1 million through all the tireless efforts across this year and through wonderful support of the community. But that still means we need $1 million to fill in the gap for this year. And that's why we critically need every individual to assist us in raising this last $1 million. Each and every day through our crisis intervention services, we are saving lives and we're keeping our communities safe.
So 3 years ago today, I was in a really dark place. I was in this hole, and today it's a lot brighter, happier, and I have a new look on life. I appreciate that David Lawrence Center gave me a place to be myself and to feel safe from myself, because at the time I was really not trusting myself. I didn't know my mind could get that dark, and for them to give me a place to finally trust myself and be free from myself was what I needed at the time.
Family today is stronger than it's ever been. There's been so much growth that has happened. The communication is open. We don't judge each other. So if Chloe or anyone else in our family is feeling this way, we now know how to help them. And we are that positive ending. We're the happy ending. And I feel so blessed.
We need you to stand up for people and children like me that are struggling.
We stand ready. Now we need you to stand with us. We can't do it without you.
Good morning. Thank you so much for having me here. Again, Scott Burgess, the CEO at David Lawrence Center, and blessed to be so. And very fortunate to be with you all this morning and with my esteemed colleagues and partners that I'm so fortunate to work with literally pretty much every day of the year in Sheriff Rambosk and Sergeant, the Lieutenant Leslie Weidenhammer. And I'm going to share my screen here so that I can run through a few elements that I think you may be interested in the conversation, and looking forward also to question and answer as well. So if you have some questions as we're going through the presentation, please feel free to go ahead and put those in the chat box, and we'll attend to those at the end of the presentation. But again, thanks for allowing me to be here. And I did mention in the video a little bit of backdrop related to the magnitude of the issues that we have been facing and that we are facing in our country. But again, we do have 2 suicides in America for every homicide. And we talk about homicide a lot, and we try to figure out how we can eradicate that scourge across our country. And it's a really important issue. And if you would double that issue, that's our suicide epidemic in the country. And unfortunately, we don't really talk about it. We don't have open dialogue around it, and we really are not resourcing it very well. And again, these are potentially life-threatening healthcare conditions if they're not attended to, and that suicide rate is certainly a manifestation of that. Sadly, also, the rates of suicide have been increasing for children across our country and now rank as the 2nd leading cause of death for kids across America. And I didn't mention this last point in the slide, that this is why we're really focused on early identification and early intervention, because a lot of the mental health issues will manifest young in individuals' early years. And yet when we look at the studies, there's about a 10-year delay between the first onset of symptom and the first onset of treatment. So we know, just like any condition, the earlier we identify it and intervene, the better the short and the long-term prognosis. As it relates to, this is kind of a staggering one, that more teenagers and young adults die from suicide than from lung cancer, heart disease, AIDS, birth defects, strokes, pneumonia, influenza, and chronic lung disease combined. So we're talking, again, the magnitude is significant, and obviously our resolve remains significant to tackle them. There's been a dramatic increase in mental health challenges with COVID. That's primarily manifested itself in depression and anxiety around all the uncertainty and all the things that we're going through as a society and as a world with this pandemic. So these issues have been growing, and a very recent CDC study found that 75% of respondents in that young adult reported significant adverse mental health challenges. So, 7.5 out of 10 individuals and 25% of them actually responded that they were having significant suicidal ideation. So again, this is a pretty dramatic overlay of challenge that we're seeing. Additionally, I wanted to talk a little bit about the epidemic that we were facing and are facing related to the opioid overdose epidemic in our country. And you can see the graph here speaks for itself. I just recently, just 2 days ago, got the updated information that for the 12 months ending May, for the last 12 months ending May, that number is now 81,230 persons who died from overdose. So we are still having significant challenges in that regard. I often say that we were fighting 2 epidemics before the pandemic. We had the suicide epidemic in our country, the opioid overdose epidemic, and now we've got the pandemic with a serious mental health overlay of challenges associated with that, and significant increase in substance use also during this pandemic. So very quickly on David Lawrence Center, we have been in the community since 1968, so over 50 years now. We're one of the larger not-for-profits in the community, and we do provide comprehensive mental health services. I'll talk briefly about that. And we provide support to between 9,000 and 10,000 unique individuals every year. And I say it unique because everybody is unique. And their pathways for recovery are unique as well, obviously. But we only count the individual that's the identified client that we're providing support to. But we always provide support to moms and dads and siblings and grandparents and many others that are around the individual. So the impact is well beyond that 9,000 to 10,000 number, but it's substantial. And for those 9,000 plus individuals, we provided almost 300,000 services this last year. And we're committed to providing services to everybody in the community. We have a sliding scale based on income. Nobody's turned away based on income, or if they have insurance or don't have insurance. Individual that has low income might only pay $3 to see the doctor for a visit. So we want to make sure that we're breaking down every artificial and real barrier to treatment possible. We do have multiple locations, and in an interest of time, I won't go through those, but 6 different locations here in Collier County. And we provide support for children, families, and adults. So the whole age spectrum. And we also provide services to the full spectrum of mental health challenges, from anxiety issues, depression issues, formal thought disorders like schizophrenia and other types of conditions. And we provide support for those that are struggling with substance use disorders or addictions. And many, over 50%, will struggle with both of those conditions. So that's called co-occurring. We have a whole continuum of care, meaning that we have everything from 24/7, 365 emergency services. We really do act as the behavioral health emergency room for Collier County. So we have the emergency services, crisis services, and we never close. We have inpatient supports, and I'll talk briefly about that. We've got outpatient supports as well. So your traditional kind of individual counseling, family counseling, and doctor's visits and the sort. And then we provide a lot of community-based support. So we're going into homes, working with kids and families. We're working with adults that maybe have a serious, persistent mental illness that need a lot of support with their daily living skills. So those are areas that we work with quite often as well. On the inpatient side, I mentioned we have a children's unit and an adult mental health unit, and in total, we have 30 beds. And that's not near enough capacity. It's one of the things that we'll be sharing about in the course of the conversation, that we're looking to expand that capacity here in Collier. And then we also have inpatient types of supports here at David Lawrence Center. In our detox unit, we have 12 beds. And then we have what used to be called the 28-day program, a residential rehab substance program called Crossroads. That's 18 beds. And you saw in the video clip about a very exciting new launch that we did even during the pandemic, which is our first certified recovery residence called Hope Home, which is nice transitional housing opportunity for individuals that need longer term monitoring and support and assistance to get them on their recovery path. We have a whole host of other types of supports for those that are struggling with addiction, including medication-assisted treatment, which is the most evidence-based practice related to those that are struggling with opioid addiction. In addition, we partner a lot with the sheriff, and I'm going to kick it over to him very quickly here, and the judiciary. We're very proud in Collier County to have a great system of partnership and collaboration, and we're always trying to find opportunities to divert and deflect people out of the law enforcement system and into the treatment system whenever possible. And we run here in Collier County the mental health court, a drug court, and a veterans court. Those are all opportunities for people to be able to be linked with treatment. And so long as they're following all their treatment support and doing the things that they need to do, they're having less consequences, if you will, through the judiciary. And we've had tremendous success related to that. And I'm sure the sheriff will talk about some of those other programs that we're blessed to partner with him on. And treatment works. So here's some data that just kind of reinforces the fact that when we invest in this type of work and these types of services, they make a huge difference. So for example, it identifies here that the studies would say for every $1 invested in treatment, up to $27 is reaped in cost savings. So we know that it's something that works. And we want to try to provide support to as many people as possible through those programs as well. So I'll just use this graph to kind of kick off for the sheriff here. This is the number of Baker Acts, and those that are maybe not familiar with the Baker Act, it's the involuntary psychiatric hospitalization process or procedure here. in Florida. So in order for somebody to meet that criteria, they have to either be a danger to self or determined to be a danger to others. This is the growth pattern of the Sheriff's Office number of Baker Acts in Collier County. We had a little bit of dip in 2020. That was mostly related to the months where people were really hunkered down completely. It was on path to be higher in 20 than 19. Before the first few months of the pandemic, and now after everybody's getting a little bit more open, that's happening again. But that's kind of where that's at. And then this is the service growth in Collier County. So when we talk about trends in need, the blue line is the number of services provided by David Lawrence Center year over year. And so our service growth has increased over 100% in those 8 years. And the top line is the population growth. So some of the things that we're seeing in Collier County, some of the things that we're seeing is population growth related, but there's a lot that's not accounted for simply by population growth. We are seeing more challenges and issues associated with these conditions. And with that, I'm going to kick it over to Sheriff Ramboss.
Thank you, Scott. Good morning, everybody. It's great to be with you all to talk a little bit about law enforcement and public safety. I've been in it for more than 41 years now. And, we've always played an integral part in mental health crisis and substance abuse. But as you probably already know, when you look at law enforcement, you think, unfortunately, about jails being the largest mental health facility in a community. It was no different here years ago. And that's one of the things that we're trying to make a big change in. And we'll talk about the central receiving facility in a little bit. But there was also minimal training for law enforcement and public safety. We really, in our community, and I'm talking years ago, didn't have enough mental health or substance resources that we could avail ourselves of. Yet, if you look at us as first responders, we were typically, other than those that walk into the David Lawrence Center, are called upon to respond to mental health crisis. So today, if we fast forward from those years ago, Collier County is a very different place. And it's unlike most of the rest of the country. And it's really because of a couple of things. One is community partnerships, the DLC, NAMI. We work together with the Collier County Public Schools, Drug Court, as Scott mentioned. But we have a lot of community contact from our organization. And then there's community support, like yourselves, who are working as a community together with us to try and provide health and direction and diversion out of the law enforcement realm to get people healthy in our community. So in 2008, I first met with NAMI and we discussed the county's needs, reference mental health. We talked about training. I was able to meet with families and learn the impacts that they were under, and also those impacts relative to our responses. And so one of the things that was raised at the time was that of a new program called the Memphis Model CIT program. And that was a 40-hour program. We did a pilot in 2008, but in 2000, and it was so successful, in 2009, when I was fortunate to become the sheriff, I made a commitment to NAMI and all those who were looking at changing mental health response in Collier County to train all of our law enforcement and corrections deputies in that 40-hour Memphis model. And really, I look beyond that at changing the culture of law enforcement. And one of our mantras from that day was service to others before self. we didn't know what things were going to look like 12 or 13 years later, or where we were going to be, or where the need or discussion for mental health was going to be. We just thought at the time that that was an important investment to make. So thus far today, we've trained 2,117 law enforcement officers, corrections officers, and actually support staff as well. And we've gone really beyond, because we've invited in now EMS, fire rescue, and that is something that many communities are just not doing, because we're all responsible and we're all part of that emergency response. But I will tell you that we could absolutely not have gotten to the point that we've gotten to with the training and the support without NAMI and without the David Lawrence Center. It just absolutely wouldn't happen. So even though I know there are a lot of my peers that are out there, they'd like to do more with mental health, they do not have the community support or the professional services that they can do this. We are very, very fortunate that we've got that here. And we really need to look much further. In our organization, once we had a lot of our members trained, we talked about creating a mental health bureau. We did that about 3 years ago. Lieutenant Weidenhammer is in charge of that. She's done a fabulous job in moving us forward to change how law enforcement and public safety thinks about getting people diverted to the professionals that can absolutely help. And of course, here that's the David Lawrence Center. So if you, a little bit more on what are we seeing daily? You know, what are the impacts in Collier County? Because we live in a beautiful community. You don't think a lot of this need is there, but it really is. You know, if you take a look at the issue paper, there were statistics in there through the end of November in 2020. But I'm going to tell you, tragically, those numbers for the last 2 months of the year for 2020, now that we have the full numbers, have dramatically increased. And of course, if you think about the holidays in November and December, that typically always occurs for us. So our calls for mental health service are now at 3,524 for the year. Our suicide crisis calls were 5,465 calls. Our welfare checks were over 2,600. And so you can see we had even though the numbers overall were slightly down, we had a lot of call for service in that last couple of months of the year. Our mental health intervention team, which is part of our mental health bureau, is a proactive group that goes out and they responded to 1,000 calls for service last year. And, you know, our philosophy there is prevention, intervention, treatment, and wellness. And it's really a co-responder model where we have built law enforcement deputies, civilian deputies, and professional clinicians. And we do that in partnership with the David Lawrence Center. And if you look at how that unit works, we've been keeping statistics shortly after it got started. And if you look at September 2019 statistics versus the same period in 2020, September to December, the end of the year, 2020, September to December, in 2020, there was a 17% increase in mental health bureau contacts. So that's, you know, comprised of individuals struggling with mental health issues as well as substance issues. So, you know, when you think about where we have been through the last year and look at it so far in the first month of this year, we're already seeing in January an increase in the number of contacts from what we did last year. The LEO Baker Acts, you can see over time, the last 10 years have dramatically increased. I can tell you that with the training we've had, with the philosophy and the changes we've done, we've been able to handle those calls for help a lot differently than we have ever in the past. And that continues to be very important for us. So we attribute probably the slight downturn last year to the pandemic. We've actually heard from a lot of family members and individuals, they didn't want to call for assistance because they really didn't want to be exposed to the potential of COVID-19. And even though, the whole year statistics were down, we saw during that period of May to September, which was the height of the pandemic concern, we saw an increase of 15% of calls that we had to respond to. So we know that it's a continuing problem. We know it's a growing problem. We know we haven't had a lot of requests for help yet, but we're going to see that this year particularly. Our Mental Health Bureau have talked to those who they have contact with, and the individuals that they're talking to, we're finding that they're more acutely ill during this time. And it has a lot to do with the isolation that we have all gone through, people not following up on their appointments, quality of life issues. And as you all know, that's not a good situation for those with mental and emotional wellness issues. Just a couple more things that I think are important. In 2020, there were 856 individuals that had actually been transported to the jail that were unable to be diverted, who self-reported having mental health issues. So that's a lot of people. Our objective now and in the future with the central receiving facility is and has and will always be to divert as many of those people as we're able to. And we're going to continue to do that. In 2020, we saw an 8% increase of those in crisis from 2019. And that includes those with suicidal ideation, mental health issues, wellness checks, and also drug-related calls. So in 2020, what we're responding to, we saw a 35% increase in the use of Narcan by our deputies. And in fact, let me step back a second. 35% increase in the number of calls and 18% increase in the number of Narcan that's been used by patrol and EMS. And today, effective probably 2.5 years ago, we have equipped all of our road patrol deputies with Narcan because we started to see such an increase in those with addiction problems. In 2020, over 900 individuals arrested and taken to jail self-reported having a drug addiction problem. When people come into the jail and they're addicted to drugs, we have to spend a lot of time and resource with medical trying to get them off drugs. And we don't really have a great plan for transitioning them back out into the community. And that's one of the things that Scott and I have been working a lot on, trying to ensure that, look, we've already made an investment in people. We've gotten them to a more healthy point. We need to get them to a facility that can transition them back safely into the community and not return to the jail, because that costs a lot of money. It's not only the housing of individuals in jail at an average of $160 a day, but the drug treatment, if you go to a private facility, you're talking $30,000 a month for private support. And we've got people halfway there. We need to do something when they leave. We've started a program where we provide Narcan kits to those leaving jail, because although we don't want them to relapse, unfortunately they often do. We created a new policy about 18 months ago that said, listen, if you're addicted and you want help and you've decided that, you can call law enforcement, the sheriff's office, and we will not arrest you. We will come and get you. We will safeguard you. We will transport you to the David Lawrence Center, and they will help you transition out of drugs. So we've been doing a lot of things. We're now collaborating with EMS in follow-up. And I think, you know, one of the things that we in law enforcement and first responders and as a community really have to commit to is we can sit back and respond to calls for emergency and try and resolve them, or we can proactively address and try and prevent and intervene and get people to the place that can change their lives. And that's really what our philosophy is. You know, we as first responders are committed to those in crisis, to get them the help they need, the follow-up support they need, and to become healthy. But I can tell you this, without the central receiving facility, without NAMI, and without the David Lawrence Center and the courts, that is not going to be as successful as we are today. And in fact, with what we see coming, and that's certainly an increasing need for those services, if we don't come together as a community even stronger than we have, we will not be that successful. And I'll turn that back over for a couple of comments and then looking forward to questions.
Okay, thank you, Sheriff. I'm going to share my screen now. So I just want to again thank so much Scott and Sheriff Rambos for shedding light on this important need in our community. I just want to be very brief here because I want to dig into some questions, but I also wanted to congratulate you both and your teams for all the hard work that you've done so far and continue to do every day. And we appreciate so much your collaboration. So as a community foundation, as Lindsay mentioned earlier, utilizing the community needs assessment as a guide, and after convening several nonprofits in Collier County, we have decided to launch a $15.5 million campaign to help address the spectrum of needs across our community, including mental health and substance abuse. This campaign is called the Your Passion, Your Collier campaign. And as a reminder, it's in these 6 areas, also including mental health and substance abuse. Specific to that area that we talked about today, we have had a series of collaborative sessions with multiple partners focused on this area. And we identified the top 2 areas of focus that we are going to support where the Community Foundation can invest to make an impact. We plan to raise and deploy $3 million to support 2 different areas. Working with the county, law enforcement, media, and the David Lawrence Center, we plan to develop a community-wide awareness campaign on mental health and substance abuse. From that, we know that many more people will come to the forefront needing services. So we hope to provide the funding for additional staffing, counseling, and other support services to address this high need and growing need in our community. So please, we can't do this alone. The campaign is called the Your Passion, Your Collier campaign because we hope you will plug in wherever you feel passionate about moving the needle in our community. So please get in touch with either Eileen or myself or anyone on our team or Scott or Sheriff, any of our partners. This is really important that we all come together to continue to improve our community into the future. So let's open it up to questions, the good stuff. Lindsay, did we have anything come in while we were presenting?
Yes, Sheriff, there was a question for you specifically regarding the training of law enforcement. And how are they trained to recognize the mental health issues to avoid some of the mistakes that we're seeing that are making the news across the nation? So if you don't mind expanding just a little bit on that question.
Oh, absolutely, because that's one of our strongest points in our organization. I mentioned earlier the adoption of the 40-hour Memphis Model CIT training program, team program. That actually was created by the Memphis Police Department after they have had some tragic incidents. The state of Florida requires law enforcement have very basic numbers of hours of training. They have increased that slightly, but the 40-hour Memphis model touches on each of the elements of that question. It is recognizing the crisis that you're responding to. It teaches how to de-escalate that crisis. It then looks at how we get that person to the help that they need. That is a significant investment of time, but such a critical one. That's why we in our organization decided that we were going to invest in that type of training. It's taken us about 10 years to get our 1,600 people trained. I've talked at the National Sheriff's Association and the Florida Sheriff's Association and have recommended that 40-hour Memphis model be incorporated into law enforcement training nationally. Because I'm going to tell you that most places in the country do not have sufficient training. They're not using that model. I will tell you that unfortunately, some of my peers believe that they respond to more of a criminal incident and try and resolve that. But unfortunately, that's what's leading to the incidents you're seeing in the news. It's not being handled correctly. And a lot of that has to do with training, but it also has to do with the culture of the organization and why are we here? Why are we here as a first responder? We can certainly be tough on crime problems, but we can also be very service oriented. And that is the philosophy that we've taken. Hold down crime. We're at our lowest point since 1971 in Collier County. That's absolutely terrific as a community. I can tell you that our jail population is down at its lowest point in probably the last 25 years because we're diverting people who shouldn't be in the jail. And I'm going to tell you right now, and this is not thought of by all of my peers, not everybody needs to go to jail. And in fact, a lot of people shouldn't be going to jail because you don't want me treating you for mental health or substance abuse problems. As much as I'm committed to helping you, you really need a professional like the David Lawrence Center. Yeah, you don't need me.
Thank you, Sheriff. I know we've had a couple other questions chatted in here, but Scott, I wanted to pose a question to you quickly. In 2017, and I failed to share this earlier as I was talking about what has sort of framed our different priorities. In 2017, there were some conversations, I believe that Commissioner Andy Solis sort of was the head from the county that brought some partners and individuals to the table and came to you all and said, what can we do? What are our priorities? Help us take a look at the data. Let us frame a plan and put this plan in place. And in 2018, the county did approve a plan that outlines 6 different priorities. I know Lieutenant's involved and a number of other partners. We were happy to come to the table as a community foundation and fund that plan along with other pieces of it. Can you talk a little bit and share a little bit about that plan? Maybe highlight a couple of the priorities. I know you've both sort of hit indirectly on a handful of them, but share with the group a little bit about that planning process and then also the continuum of it, because I know that there is still a group that has slightly expanded even and is still continuing to move the needle on a number of those priorities.
Sure, absolutely, be happy to. So it's a great introduction to what the process was that the commissioners recognized, and primarily Commissioner Andy Solis took a strong passion towards looking at these challenges in our community and kind of seeing that there was growing concern. Pretty much every one of the community assessments that were being done by, whether it was the county's public health department or community foundation or others, was reinforcing the significance of the mental health and the addiction challenges in our community and need to address them in a comprehensive way. So he and I dialogued, and he was surprised to find that there had never been a strategic plan for the county related to how to effectively address these issues. And he said, one of his lines I remember, he said, "We've got a strategic plan about everything, including how we maintain the medians. I can't believe we don't have a plan that's so important related to this." So fast forward, we got a coalition of amazing stakeholders, and Lieutenant Weidenhammer and the sheriff. Their input was so critically important, and many others. We had the school system there, and local hospitals, and all sorts of individuals that really have different touch points around mental health in our community. We came together and we built a plan that was based on evidence-based and evidence-informed practice. We had additional facilitation of some of those stakeholder groups by USF, which has a Center for Psychiatric Research. So again, we were kind of bringing the academic, we were bringing in some of the best practice from SAMHSA, which is the federal government, on their evidence-based toolkits, and really brought all that together and looked at the lens of that for Collier County. And I think we came up with a really wonderful strategic plan that I'm very proud of, to have been a partner in it. And we were fortunate to be able to present that to the county commission, to have them ratify that as the county's strategic plan for the next 5 years. So we're excited now that we're actually kind of in the implementation phase of a lot of these things. And just to highlight maybe 3 elements of the plan, there's 6 priority areas. But just to highlight 3 of them, at least a couple of which, actually all 3 of which I think were in the Community Foundation's synopsis that was in the paper today, is the need for the central receiving facility. I mentioned before that we lack capacity for inpatient and crisis care, and for those with serious substance challenges, to divert them away from law enforcement and into treatment. We're seeing more and more of that need, which basically means we need more beds in order to have those individuals have a place to come to get that start of their treatment. And that's what's known in an evidence-based practice way of called the central receiving facility. So there's going to be a building that will be built that will enhance our capacity, which is wonderful. That was part of the sales tax initiative that many of us voted for when that came up a couple of years ago. So there's a 1 cent increase to every dollar in sales tax that happens when people go buy a Coke or whatever you're going to buy in the community. For every dollar, there's 1 cent that's added to that goes to this sales tax referendum. One of the projects that was in that referendum was this mental health central receiving facility building. So we're now in the process of being able to move forward with that. We're excited. That's going to basically double the capacity, bed capacity that we have. But we do have an operations challenge with that. So it's great to have a building and beds, but we need to have doctors, nurses, clinicians, behavioral health technicians to help support those individuals. So we're needing to raise money around the operations of that. So that's a really big issue, because last year we ended up sending over 600 Collier residents out of Collier County because we simply didn't have capacity here. So we need to address that right now and into the future. Another element, very briefly, is, and Sheriff touched on it a little bit as well, is the need for transitional housing. We know that, individuals starting with us and having a 3 to 5 day crisis inpatient stay, or even a 28-day stay in our substance rehab program, isn't the end all be all perfect cure for everybody. For as far as a recovery pathway, people usually need to have a longer launch pad. So we really believe that the community needs more of these certified recovery residents, as well as transitional housing support. That's also evidence-based and evidence-informed nationally. And that's something we're excited to continue to advance here in Collier. And then lastly, we've talked about it briefly in a few different ways, and Community Foundation is already supporting this in a significant way, which is raising awareness. So raising awareness around mental health, decreasing the stigma, and encouraging people to get help and care sooner rather than later. So, you know, you've seen some of the campaigns likely, which are It's Okay Not to Be Okay. And then there's other ones that really kind of reinforce that we shouldn't be thinking about mental health issues or substance issues any different than any other healthcare issue. You know, you shouldn't be embarrassed or feel guilty to go see a counselor, like you don't feel embarrassed or guilty if you've got an ear infection and you go to your general practitioner. So we just need to change the language. We need to change kind of the culture, and that will help people feel more comfortable seeking care sooner rather than later, which we know is going to benefit everybody, the individuals, families, and our community.
Can I also jump in and just tack on to that a little bit? You know, with as long as I've been here, I was here well before there were any of these services. When we had mental health crisis individuals, we wound up going to the emergency room of NCH. That was pretty much it. Today, and the reason why the central receiving facility is going to be so critically important as we move forward, we've done all the training that will help identify people in crisis and know what to do with those individuals and to get them to a facility. And you can see the numbers have been up so dramatically. If we want to continue that proactive approach, it's going to increase. And we really need a place, because we've overrun DLC's entry emergency area many times. And, you know, if we're going to have a program in the community where we're making it a priority to get people to help, we need the facilities that can help them.
Thank you both. Thank you. And Lieutenant chatted the link to our Collier Coalition for Healthy Minds, which is the group that's sort of retained and is moving these priorities forward. So I encourage you. We were happy again to support that website being created, and there's a lot of really great material, news, information, and the priorities are all listed there if you'd like to learn more. There's two questions that came through the chat that I'd like us to tackle. Scott, and if you would, could you just give a little brief overview of NAMI and what NAMI is and does within our community? That's been a question in the chat. And once you've done that, if you would both just like to talk a little bit about how this mental health and substance abuse, talk about diversity in our community, because we certainly are seeing our community shift and change. We see the numbers in our reports and the projections of how our community is becoming more and more diversified, and we all know that looks different and means different things. Can you talk a little bit about maybe some cultural differences in how you provide services and touch on that a little bit for us too?
Sure. Well, I'll start the NAMI question, and Lieutenant Weidenhammer is, I believe, still on the board of NAMI. So if there's anything that she wants to add, please feel free to do so. But NAMI, the National Alliance on Mental Illness, is a national organization. We have a chapter here in Collier. It's one of the oldest mental health not-for-profit advocacy groups in the entire country. And what they have historically focused on a lot is raising awareness, advocacy around these issues. And there's been a lot of support that has been provided through NAMI to family members. Family education and training and how to help support your loved one that might be going through a mental health challenge. One of the things that you heard about Adrian in the video, the mother was these are just things that you don't really learn about. Even if you go through health class in high school or in college, you may have a textbook that has 350 pages and you've got probably 3 pages on mental health, right? So these are just things that people aren't all that familiar with. And so they walk along with families and individuals in better understanding what might be able to be brought to bear as far as helping their loved one. Here locally, our NAMI also has a drop-in center called the Sarah Ann Center, which is open, during the day, and individuals that have these challenges can go there, receive, support. They have peer specialists that are on staff, individuals that have lived experience with mental health challenges that now can walk along with individuals to help them. And there's a lot of support that they provide there. They also try to help people think about those next steps about going back to work and what types of support could they have around that. So it's a great resource. We really love working with NAMI, and as Sheriff mentioned, NAMI is a major partner in the CIT training that has been conducted so successfully. I mean, I really want to tip my hat to Sheriff and what's been done here in Collier County. I mean, it's really like almost literally unheard of across the country to have a sheriff so committed to this effort and to train. It's a tremendous resource cost when you think about 1,600 officers and deputies and staff that go through this training. Well, that means that somebody else needs to be out on the street. So there actually is a pretty significant cost to all this training as well. And it's a great investment, but it really takes a lot of leadership to implement that. And that's why you don't see it across the country like we've seen it here. And then quickly, I'll just mention on the diversity front, I went through the slide, I think, pretty quickly on our different sites and locations, but we do have a site out in Immokalee. We've been out there since 1988. We pretty much have our own mini community mental health center out in Immokalee, offering all of our support services like we have here in Collier or in the Naples area. That's provided out there in Immokalee other than inpatient support. We don't have any inpatient, but everything else, doctor services, counseling services, case management services, home-based services, that's all available out there. And one of the things I will say from a diversity or culture issue is that certainly there are some cultural influences around mental health with the Latino community and also the Haitian community. So you really almost have to be a trusted source or a trusted entity in the Immokalee community in order for people to be willing to open up and seek support, especially around mental health and addiction challenges. And I like to believe that we've really earned that across many years being in Immokalee. So we have a very robust set of services and programs out there. And then here in this area, in our main kind of campus, we have individuals that are bilingual in Spanish and in Creole, which are the two primary languages. And we do a culture assessment as a cultural part of the assessment to try to determine what are some potential cultural influences. So everybody that comes in, we kind of have a better understanding of what their perception is or expectations are of treatment. And we try to tailor our approach as much as we possibly can to meet those expectations.
And I would tell you that I agree completely with what Scott has said with regard to both of those topics. Just reinforce with you that without NAMI, we would not be able to train the 40-hour Memphis model training. I should say we probably could, but it would be so difficult to do and to do it right and to do it well that, academic only out of a book or in a classroom doesn't get it. You've got to actually go out and visit these centers and do role playing. And that's what this is all about. So we really need them and their support. As far as trying to provide help to those who need it, I will tell you, as we do with responding to any emergency, we respond to all our residents, whoever's living in Collier County. If you are in crisis or if you are a victim of crime, we respond fully. We've done training in language so that we can make that contact. We are out in the public as much as we possibly can to let people know, again, that we're here, we're available, we're there to assist. I'll tell you, some cultures look at law enforcement as something very different, and they look at it more like where they're from, and it's more military than it's not. But in our mental health program, we actually will respond in I'll say it, a soft method, without a lot of lights, without sirens, plain clothes in some cases. Lieutenant Weidenhammer has really a repertoire of responses, and they try and tailor that to what's needed. So we also employ civilians and clinicians. So, if somebody really doesn't want to see somebody in law enforcement or government, period, we can get somebody who is a full civilian clinician to respond. So we have a lot of opportunities there. I'll tell you, we are going to continue to build that until everybody's very comfortable that no matter what your need is, we're going to get you at least a first response.
Thank you, Sheriff, and thank you, Scott, too. I know we started a few minutes late, giving people time to get on, but I want to be respectful of everyone's time as well. And it is 10 after 10, and I promised us all to be finished at 10. So I apologize for taking us a little bit over, but this is such an important conversation. I wanted everyone to be able to have that opportunity. If you have a question, you are welcome to reach out to us, and we would like to get that answered for you. We will connect you with the right person. And I think Julie wanted to just share some closing thoughts. Oh, Julie, you're on mute.
There we go. I just wanted to say quickly that, as we've heard today, the first step really is raising awareness. And that's why the Community Foundation has an issue paper, as Lindsay mentioned earlier, coming out in the Naples Daily News starting today with mental health and substance abuse, and every Friday from now until March 19th on these top areas of need in our community. So we encourage you to go pick up those issues, as well as join us in similar conversations to today on the topics that are here on the screen. And we just thank you so much for your valuable time. Thank you to Sheriff and Scott for your time and all the work that you do in our community. And again, apologies for wrapping a little late, but such an important topic and a lot to cover.
Thank you all.
Thank you very much.
Thank you.
Thank you. Happy Friday.